Hello everyone, my name is Dr. Sherwin Hariri. I'm a board-certified allergist and immunologist here in Beverly Hills, California. And thank you for having me on Lupus LA's Facebook Live Q&A session today. I'm going to try to answer some of the questions that have been coming in regarding COVID, give a brief COVID update, and see if we can answer some of the unknowns and some of the questions that a lot of patients have with or without autoimmune diseases are actually still unknown, and there is no evidence-based answer to some of these questions. So, over 2 years since the pandemic started, here we are still in the middle of potentially another surge. There are some positives. We know more about COVID. It seems like at this point, the disease itself is less lethal for most. It is less virulent. The variants are maybe more contagious and people are catching COVID more quickly, but most people, including most patients with lupus, are not getting as sick as they used to be. This is because the virus is less deadly, even though it's still very dangerous and contagious. Generally speaking, fewer hospitalizations are needed. And also because, secondly, we have more treatment options. So we have preventative things like obviously the vaccine, and we have the monoclonal antibodies, and we also have Pacslovid, which is the antiviral medication that you can take if you get diagnosed with COVID. So let's start with some of these questions. So question number 1 is asking me, if you had a flare after receiving your COVID vaccine booster, what should you plan for? Should you receive another booster in the future? So right now, the CDC is recommending that everyone, including kids, get dose number 1, dose number 2, and then a booster, the first booster. But it is also recommending that patients over the age of 50, as well as patients under the age of 50 with an immunodeficiency or a pre-existing condition, should get a second booster, which is dose number 4. Well, that's definitely true. For most people, it may be beneficial. I would say that if you have well-controlled lupus, and of course, you have to discuss this with your rheumatologist, but if your lupus is very well controlled and you already had COVID recently in the last 2, 3, 4 months, then you probably still have natural immunity from the disease. And if you had a flare from the booster, you may want to stay away from the second booster just for now. If you haven't had your regular booster yet, but you had a flare from the vaccines, we need to look at this on a case-by-case basis. If your flare was mild, then your rheumatologist may want to treat you and not, let's say, hold your steroids or not hold your biologic agent, any of the medications you may be on, like methotrexate or Benlysta, etc., and continue those medications so your disease is better controlled, and then still give the booster. So not everyone who had a flare from the booster had a flare from the second booster. So just because you had a flare from the vaccine the first time, that does not necessarily mean that you will have a flare from the booster or from the subsequent vaccine doses. If you had a really severe flare, then you probably shouldn't get the booster, and you should get the monoclonal antibody that can prevent, that you would get prophylactically, so to protect you from getting the disease. And if you had natural infection with the SARS-CoV-2 virus, so if you had COVID fairly recently and you had a flare from the booster again, then you may want to hold off on getting the booster. One monoclonal antibody called Evusheld is a monoclonal antibody that protects you and prevents you from getting the disease, or at least the severe case of the disease, by giving you the antibodies passively before getting COVID. It's prophylactic, so prior to any exposure, pre-exposure. And so those are all options. But again, if you had a flare from the booster, that does not necessarily mean that you should totally forget about getting the vaccine. Please discuss this with your rheumatologist because that's an important question. Question number 2, are there any treatments for long COVID that are helping autoimmune and lupus patients who flared after clearing COVID? So yes, we've seen cases where patients had COVID and they, cleared the disease, the virus pretty well, but then their autoimmune disease flared up. Or we've even seen patients with allergies get worse allergies or get hives. There is not one treatment for long COVID. Treating long COVID means treating that one condition that you are dealing with, because long COVID can cause brain fog. Long COVID can cause, generalized fatigue. It can cause a chronic cough and lung problems and exercise intolerance, and sometimes it can cause a flare. So if you get a flare, then you are going to have to see your rheumatologist, see what type of flare you have, see if it is from COVID, and that flare just needs to be treated the way any lupus flare would be treated, but it is often very treatable. And so there is not one medicine to treat long COVID. 3, is long COVID affecting more autoimmune and lupus patients than other people, or are there factors being identified for people with long COVID? So there's research going on, but at this point, I don't have an answer to that question. There may be an answer, but I'm not necessarily seeing more lupus patients with long COVID. We are seeing lupus patients sometimes flaring after getting COVID and having worsening lupus, but I'm not necessarily seeing many autoimmune patients getting worse long COVID in general. Question number 4, how long are boosters effective for those with lupus? Is it a different length of time if you are on hydroxychloroquine to treat your lupus? So let's talk about hydroxychloroquine really quickly. So first of all, generally a very safe and good drug for those with lupus. And if your lupus is controlled on the hydroxychloroquine, that's great. It's not directly preventing you from getting COVID. There's no direct evidence that hydroxychloroquine protects you from getting COVID. However, the way it is protecting you is it's protecting you because it's controlling your disease. And what you want is you want your lupus to be very well controlled in case you do get COVID. And so the boosters are as effective from what I know in patients with hydroxychloroquine as with patients without hydroxychloroquine. In other words, hydroxychloroquine or Plaquenil does not decrease the efficacy of a vaccine or the vaccine booster. That said, patients with autoimmune diseases may not respond as well to vaccines in general. So the vaccine may not work as well in lupus. That's not necessarily the case with this vaccine. It seems like most lupus patients, unless they have severe immunodeficiency, severely compromised immune system, if they're on high doses of steroids, if they're on high doses of strong biologic agents, or if you're on 1 or 2 infusions, then your immune system may be compromised. And even though the CDC does not routinely recommend that you check the antibody levels, in those patients, I do recommend the antibody level to be checked. And you should check your antibody levels, if you're going to check them, at least about 2 to 3 weeks, maybe to play it safe, a month after you get your vaccine, to see if you were able to mount a response. And there's a way to check and see if you got antibodies from the vaccine or if you got antibodies from COVID, the disease itself. And if you got the antibodies from the vaccine, then you can monitor the levels, and your rheumatologist or immunologist could monitor that. You may want to see an immunologist if the rheumatologist doesn't feel comfortable, and an immunologist may be able to check your antibody levels. And each person is going to be different in general and also in lupus patients. Every single person will have slightly different lengths of time for which the booster is effective. but we think that it's approximately 6 months. And that's why we always say if you haven't gotten a vaccine in the last 6 months, you may want to get the booster. And then they said if you haven't gotten the last booster or the last 4 to 6 months, and if you're high risk, like with lupus, then get the second booster. But antibodies can be checked. The next question number 5, is a good one. It's talking about Pacslovid. Paxlovid, for those of you who don't know, is the antiviral medication that works pretty well for COVID. And on my Instagram page, we actually put up a talk, a short but yet informative talk, I'd say, about the rebound effects, rebound COVID coming back. So, first of all, if you got COVID, you have lupus, you should be treated most likely with Paxlovid or a monoclonal antibody. Paxlovid is first-line therapy if you're high risk to treat your COVID. It's an antiviral. And so you would start taking it, and I believe it's for 5 days, and many patients do really well, and it really helps the disease. It helps the symptoms of the disease, and it often does not come back. However, lately we've noticed that in a good number of patients, I believe it's about 1/3 or a quarter, don't quote me on that one, but it's a good significant number of patients, patients are getting rebound symptoms. So they feel much better after they start Paxlovid, and as soon as they run out of Paxlovid after 5-6 days, their COVID symptoms come back, and they can even test positive again. Dr. Fauci talked about this in some news outlets. Dr. Fauci stated he had COVID and he took Paxlovid and he was good, but then after day 5 or 6, his symptoms came back and he actually tested positive again. That is happening, but that does not mean you shouldn't take Paxlovid. It is still decreasing the risk of hospitalization, and you could always ask your doctor to give you another course of Paxlovid if they find that it's needed, and that way your rebound symptoms should go away. And now I believe the FDA is looking into seeing if you may benefit from a longer course of Paxlovid. Instead of 5 days, they may extend it for 10 days, and to see if that would prevent the rebound effects. One really important point that I wanted to bring up that I discussed with Dr. Wallace, one of our rheumatologists here in Beverly Hills, is that a lot of patients are wondering if it's okay to take Paxlovid when you're on Plaquenil, and yes, there is no reason not to take Paxlovid if you get COVID and you're on hydroxychloroquine or Plaquenil. Let's move on to the next question. And again, more on Paxlovid is also on my Instagram page. You can watch the video. Question number 6, is it true that there's a new protein-based vaccine that is not mRNA? Is that better for lupus patients? Will it work better for us? Well, yes, Novavax, they're coming out with a vaccine that's not mRNA based. It's a more traditional vaccine. And the mRNA vaccines have worked pretty well in most lupus patients. So it's been pretty effective, and not many patients have had significant flares. So regardless of if it's an mRNA vaccine or not, it should work in most patients, and you can always have your antibodies checked. Don't wait for the non-mRNA vaccine if you haven't been vaccinated. Obviously, get vaccinated immediately. Get boosted if you haven't gotten boosted. But it is another option you have if for whatever reason you think you don't want an mRNA vaccine, which is, again, not what I recommend in most people. You could wait for the Novavax, and I don't know when it's going to be FDA approved, but I know that they're working on one. Question number 7, what do we know about lupus and other autoimmune patients and vaccine efficacy at this point? So that's similar to the other question. So we know that most lupus patients and other autoimmune disease patients do fairly well with the vaccine and are able to mount a response unless they are on strong biologic medications that could deplete your B cells, which would prevent you from making antibodies. You should have your immunologist or rheumatologist check your antibody levels. And if you didn't make antibody levels because of the medications most of the time, more than because of lupus itself, so again, it depends on your exact case, Then you may want to, if your antibody levels are low, you may want to get Evusheld, which is the prophylactic monoclonal antibody. So this is a case-by-case basis type question again. Question number 8, should lupus patients continue to get boosters indefinitely as they become available? Well, that's a good question. So for now, we don't know, but we think that we're going to need to get annual boosters at least. Or maybe there was even talks about every 9 months or every 6 months. But yes, if that becomes the norm, then lupus patients definitely should be getting it because you're higher risk. And again, most people do well. If you tend to flare with the boosters, then you need to talk to your rheumatologist about that. An important point I want to make about boosters. As most of you know, the subvariants currently of Omicron that are taking over the United States as well are changing, right? So the original Omicron now has subvariants. They don't seem much more virulent, but they seem more contagious. The new subvariants BA4 and BA5, there are some talks that they may be a little bit more aggressive, maybe some hospitalizations are going up. That has not been confirmed yet. It hasn't been called as a variant of concern, at least I believe until yesterday yet by the CDC. But if that happens, then all it means is that, well, this one is a little stronger again than Omicron was, and it's not weaker. And sometimes that happens, even though most of the time viruses can get weaker. That's not always the case, right? So we have to look into that. But what does this mean for the booster? Well, the CDC recommends now that we get an Omicron specific booster, not the old vaccine booster, but that we get that for now, but that we start working on one that is also has the BA4 and 5 subvariants in the booster. So there's more efficacy against what is going around now. So if you've gotten your booster fairly recently and you're socially distancing as much as possible and you're careful and you're not high risk, or if you just had COVID, then you can hold off on the booster maybe, because talks are that there is going to be a new booster, most likely this fall, to prevent you from getting the new variants, and that booster should be more effective and it will be closer to a potential winter surge coming up again. Have you seen an increase in flares or inflammation markers after receiving the multiple boosters? We sometimes see lupus flares and autoimmune flares in even completely healthy patients getting hives or getting some inflammation or higher sed rates and things like that. That's common with vaccines because the vaccine is stimulating and sometimes overstimulating your immune system to work hard and to protect it against the vaccine, right? You're starting to make antibodies, and sometimes that can make your body get overstimulated. It's not very common, but it does happen. And some people do get flares, but it's a very low percentage. More people can get flares from COVID itself and complications from COVID. And hence, we still recommend in most people, unless you've had a very severe flare before, to go ahead and get the booster. You may want to talk to your rheumatologist and allergist about potentially pre-medicating yourself before you get the booster. In some patients, that may be beneficial. Question number 10, have you seen any less protection from the booster for autoimmune patients? Again, yes, I've seen less protection in some patients with autoimmune diseases from the booster, mainly if they couldn't make the antibodies in general because they were on a medication that was preventing them from making antibodies. Typically, Plaquenil does not do that. Typically, Benlysta does not really do that. Methotrexate doesn't do it as much. But if you're on stronger biologic agents, then like Celcept maybe, or other B-cell modifying agents, then you may have issues. And in some people, some of the aforementioned drugs do lower the immune system and they can't make as many antibodies. And that's why I do personally check antibody levels in people on these medications, make sure they made the antibodies, and hopefully, we can't check the function as much, but there is also a way of checking for not just antibody levels from the vaccine, but T cell levels, T as in Tom, and that's not routinely done at all labs, but it's done at academic centers. We do it at Cedars-Sinai Medical Center, where you can have T cells tested as well to see if you have some memory protection, either from COVID itself or from the vaccine, because it's not just about antibodies, right? And most lupus patients were able to make the T cells as well, and those who we tested. So generally, the vaccine is good enough to protect you in most people. And then our last question is asking, are we going to have another wave in the fall? Well, nobody really knows, but we may. The numbers are going up. It's very contagious. A lot of people are getting it. I don't know if we're going to get a wave like last fall, where a lot of people will be in the hospital, and where the hospital system was really, overworked. Everyone was overworked, and there was close to a national disaster. I don't think it's going to get to that if things continue the way they are now with the way the virus is now. But if the new variant becomes much more dangerous, then we may get another surge like we did last year with more hospitalizations. Hence, I think it's really important. To get that new booster once it comes out, and I'm definitely going to get it once they have the booster that has the new subvariants, and it's more directed towards what COVID is today, which is Omicron and its subvariants. It's drastically changed, obviously, from what we had when the vaccines came out. There's still protection, but the reason everyone's still getting sick, even with the vaccine, but typically not deadly sick, is because of the fact that it's not targeted exactly against Omicron. So, generally speaking, and as a summary, I'm going to conclude today stating that if you haven't gotten your booster at all, you should get it. Don't wait. You'll get another one when the new one comes out. If you've gotten your booster fairly recently in the last 4 to 6 months, and if you've gotten COVID recently, then you can hold off until the new booster comes out in the fall, which is targeted towards the more, new seasonal variants that are going around. We will not know 100%, but it looks like, this is a disease we're going to have to live with. The good news is we have more treatment options. The good news is Pacslovid works fairly well. The good news is that even if there's rebound COVID symptoms, it does not mean that you shouldn't get Pacslovid. And even if you're on hydroxychloroquine or if you have lupus, you should ask your rheumatologist, but you should most likely get Pacslovid and treat it, or a monoclonal antibody, depending on what your rheumatologist thinks is better for you. And, the best news is that the vaccines and the boosters still work, and they do work in most lupus patients as well, but you could have your antibody levels checked. I hope that helps. We're still in the pandemic. It is very contagious. Many patients have already had COVID. It's becoming endemic. There's natural immunity, there's vaccine immunity, there is treatment, there is immunity passively given by monoclonal antibodies like Evusheld. So generally, we're in a better place. Numbers are going up. We may get a surge. We may need a more specific booster. And once that one is out, you should get it. If you've had a mild flare, you should probably get it, but discuss with your rheumatologist. If you had a severe flare, it does not mean that you will necessarily get a severe flare from the booster again. So these are kind of the take-home messages. There's still a lot of unknowns. This is a new disease. We're still in the middle of a pandemic. But what's the lesser of the two evils? Probably getting vaccinated versus getting COVID, which could also flare you. I will do another Q&A session probably in a month or so when we have no when we know more about the new booster hopefully coming out, when we know more about this subvariant. But I think that's it for today. Thank you for having me on today for this Q&A session, and I wish you all health. Be safe. Bye.